So I'm delighted today to have with me Professor Stefania Boccia, and Stefania is Professor of Hygiene, Preventive Medicine and Public Health at UCSC, Italy. She is also the project coordinator for the PRECeDI project, and she is currently coordinator for the ExACT project. Stefania, if I can begin by asking you about the PRECeDI project, can you tell us about the project and why it was set up?
Yes, thank you very much. So the PRECeDI project is a Marie Sklodowska-Curie Research and Innovation Staff Exchange. So it's a RISE project that has been funded in 2015, and it was running for 4 years. And it is actually a project that falls into the Excellent Science pillar of Horizon 2020. And this kind of scheme of Marie Sklodowska-Curie Action provides funding for the secondment of staff members for research, training, and networking activities. So the project is finished, actually. It's period, but it was involving a large number of partners across Europe and beyond, in the United States and Canada. We were 11 partners, and the overall goal of the project was to provide a multidisciplinary knowledge through training and research in personalized medicine with a specific reference to prevention of chronic disease. So it was basically a multidisciplinary group that involved a number of institutions that were working on different aspects of personalized medicine. So starting from basic research to economic evaluation, health service organization, and also ethical, legal, social, and policy issues. Because at the end of the day, what we wanted to achieve is to enable a new generation of researchers to make informed decisions for appropriately serve healthcare systems, biotech industries, and also policymakers in the post-genomic era. And I'm not sure if I have to say something about the main outputs of the project now.
Yeah, so I was going to ask you next. So you've already said that the project finished in 2017. So if you want to maybe touch on what the major outcomes are, and I was also interested to find out really if you have begun to see an embedding of those skills and those knowledge transfers that were gained during the project in the institutions that you worked with.
Well, basically, in our project has been set up in a way that the Commission fund this kind of project only if you have an academic and non-academic center that work together, so that the secondments are done through academic versus non-academic and vice versa. So our staff member, not only from our institution, but all the staff members that moved across the different institutions gained very different insights. I mean, those that were in fact involved in making more informed research in health economic evaluation, let's say in genomics, were seconded from a number of academic institutions to a few non-academic institutions, just to see what was really going on in the real life, let's say, of also how can I say, I mean, agencies, CRO, a completely different kind of setting from where the researchers were coming from. And this experience, also from a personal point of view for the researchers, was extremely, I mean, positive. But what was realized at the end of the day from all the researchers that moved from academic to non-academic institutions is that really we are still at the beginning of applying such a kind of technologies from the perspective of the private companies. So we are really at the beginning of transfer such knowledge into real application from pharma companies or other companies in order for being used for make their evaluations, informed evaluations. So what was the main output, in fact, of our project was to produce recommendations, because what we realized is that there is good knowledge, very good knowledge in the academic institutions, but that this knowledge has not been transferred yet to decision makers, has not been transferred yet to the private companies. And so this knowledge needs really to have a boost, to be transferred from all the potential stakeholders that work together in this specific setting.
And so, as you said, the aim of the project was to promote that knowledge transfer and to build synergies and exchange best practice. And the project had a particular focus on the omics and prevention of chronic disease. And why is it important that best practice is shared, particularly in the area of prevention?
Yeah. Well, it is fundamental that the practices are shared because chronic disease represents the largest burden of death and disease in Europe, and like 80% of the mortality is given to chronic disease, and between 40 to 80% of the overall burden of chronic disease can be prevented. So we have a number of papers that demonstrates that can be prevented, and this can be not only, I mean, a good an excellent goal for the quality of life of the people in Europe, but also a goal for the healthcare system sustainability, because if you have to cure every year a number of people that stay unhealthy with a chronic disease for a long time period, this creates an enormous burden from the healthcare system in terms of paying, you know, the cure for everyone. So prevention is really a key pillar for the sustainability of health system. What we try to address in our project was to what extent the new technologies that use genomic information can be used at different levels to make prevention be more effective, or at least to integrate traditional approach in prevention with the use of genomic technologies. And there are certainly a number of already existing applications that can be instead further boosted, like if we think about the hereditary forms of breast cancer, of colorectal cancer, Lynch syndrome, also hypercholesterolemia, there are already a number of recommendations at the international level that recommends the use in certain situations of these single genetic tests that can prevent a certain important burden of disease. This is an example of something that can be already done, but it unfortunately is not done properly across Europe. So there is still a lot to do in this sense.
There were 11 consortium partners involved with the project. What benefits did that bring to the project involving all of those partners?
Well, first of all, I have to say that they largely benefit because they were more aware about what was going on in the different countries concerning the approach currently used in personalized prevention of chronic disease. We did share our knowledge, and best practice were existing, but as I told you, personalized approach in prevention were very, very few. So we realized that there was a lot of work still needed to be done in this context. For the fellows that were seconded across the institutions, as I told you before, it was an excellent experience to gain, you know, a different also perspective. What was probably a lacking issue that is embedded in this kind of actions funded from the European Commission is that very commonly the non-academic institutions, so the private companies, all these kind of agencies, blah, blah, they do not have enough staff to be seconded to the academic institutions, so that at the end of the day, this kind of a scheme funded from the European Commission was not exactly efficient in terms of a balanced secondment flow across the partners involved. But we involved a number of new partners we didn't know before, and it was an excellent platform to exchange our knowledge and understand also what was really needed in the future to plan.
So if we move on now to look at your current project, which is the ExACT project, and that's a project which stems from PRECeDI. Can you tell us about the ExACT project and its aims and objectives?
Sure. Thank you for the question. So this is a new project that has been funded within the same scheme. It was starting on March 2019, and the duration is always 4 years, and it involves 15 partners. So I have a number of partners from the academic institutions, from non-academic institutions. So it's much larger than the one before PRECeDI, and also new partners. Some partners left the consortium, so we have a large number of new partners in this project. The objective of the projects are a bit larger than the one of ExACT project, a bit broader than the one of PRECeDI, because we want to work on the overall topic of precision health, because what we realized is in the PRECeDI project is that there are some points that should be further stressed out, like citizen engagement. We believe it's very fundamental. People need to be aware what is going on in the field of genomic sequencing, of all these new projects in Europe, 1 million genome and sequencing possibility, and also the access to the genomes in the future. And they should be more aware of the pros, not only on the cons of such a new approach, technological approach. We also identified as a new topic to address the leadership, because we believe that we need strong leadership in Europe from those who engaged in the field of personalized medicine, especially in the perspective of prevention, but not only, in order to make all the stakeholders that involve citizens, but also professionals, being aware of really the potential to put together digital solutions, genomic solutions for the benefits of the population health. So there are additional numbers of actions and research domains that have been added, and also a greater focus on the ethical, legal, and social and organizational issues surrounding precision health. So we have, at the end of the day, 5 work packages, 5 different research domains, but we do take advantage of the results of PRECeDI. I didn't mention actually among the first and more important outcomes, we published a list of recommendations in order to introduce personalized prevention and care that have been published on an academic journal, and also published a book as a result of the PRECeDI project, which is a Springer book called titled Personalized Care, Fostering Precision Medicine Advancement for Gaining Population Health Impact. And these output are the ground on which, on top, the ExACT project is working now.
Thanks. So as a final question, I just want to touch on policy, really. And with both PRECeDI and ExACT, you were working with partners across Europe and the US and Canada to share knowledge and exchange best practice. But in order for that knowledge to become embedded in practice, there is a need for regional governments to help support that transition. And I just wanted to know, do you think there is enough being done at a policy level to help support preventive medicine and precision medicine?
Well, this question is very important. I mean, this is not was not an intended goal of this project. That, as I told you, it's about funding the secondment of fellows across institutions to advance the research already existing in each institutions. So addressing the issues at the policy level and at the national level, it's something that really goes beyond the overall goal of the project. But I can tell you that this kind of activities are to a large extent linked to the initiative of Beyond the 1 Million Genome Project and the overall 1 Million Genome Project that is running since a couple of years. And this kind of project aims to involve each government in the member states that signed the declaration towards 1 million genome of Europe in order to obtain advancement at national level, because in Europe we have completely different speed in this area of genomic technology integration. We have Finland that is very ahead of some countries with already 200,000 genomes sequenced from the population. We have Spain, where of course they are very well working, but they still do not have the specialty of clinical geneticist. So we have different situations in Europe. So personally, I was able with this kind of project to test what was going on at national level, but in a limited number of EU countries. But impacting at regional level and national level is really up to the government of the different member states. And I know that currently they are working very hard in the context of the 1 Million Genome Project to make this working to some extent.
Thanks, Stefania. So on behalf of the entire SAPHIRE consortium, I would like to thank you for joining me today, and I want to wish you well with the continuation of the ExACT project.
Thank you very much, Sorcha. Thank you for the time and the interview.
Thank you.